Good morning, everyone. Welcome to Medicare Monday with Indiana SHIP, the State Health Insurance Assistance Program. I'm Susan, and I'm with SHIP here in Central Indiana. And our featured guest, and well, she's not a guest, she's a co-host regularly. Melanie Wilkinson Garland is down there in Southern Indiana. Good morning, Melanie.
Good morning. Happy Monday.
Yeah, for sure. Melanie is going to tell us all about something that's new by way of the Inflation Reduction Act, and that is a way to spread your Medicare Part D prescription drug costs over for the year. And it's called the Medicare Prescription Payment Plan. I've also seen it called the M3P. And Melanie is going to tell us all about that. And we're going to get to go on a quick field trip to Medicare.gov for some information in addition to that. So you can access that on your own from home. So without further ado, Melanie, what do you have to tell us about the M3P?
Absolutely. Well, let's just kind of dive right into it. I do like the acronym for it. It sounds very official. But yes, this went into effect on January 1st of 2025. So during open enrollment, you may have gotten a letter from your plan, or you may have seen it on Medicare.gov if you use that to compare your plans, or maybe a ship counselor or an insurance agent or someone from another source let you know about this payment plan option. And it's essentially what it sounds like. It's a payment plan. So instead of paying the total cost of your out of pocket drug costs at one time, you can actually spread those costs out over the course of the year. So, we're going to talk about what that looks like and how that works if you are someone that's kind of thinking about it, and to maybe see if it's something that would best fit your needs as well, because it may not be for everybody. Okay, so it is an alternative way to pay your prescriptions, and you would spread those costs out, like we mentioned earlier, throughout the year. It works with your current drug plan to help you manage your out of pocket drug costs for drugs covered by your plan. So it is only for drugs that are covered by your plan. Your out of pocket drug costs, instead of paying what you owe each month as you fill your medications, your out of pocket costs would be kind of divided throughout the year. So if you started it in January, you could see those divisions starting for 12 months. So instead of paying at the pharmacy, your drug plan bills you monthly for your out of pocket drug costs. So that monthly bill can include your all of your out-of-pocket costs related to your prescription medications. So that can be things like your deductible, if your plan has a deductible, your copays, your coinsurances. So anything that's coming out of your pocket, that's what you want to think about here. And then you no longer pay those full out-of-pocket costs at the pharmacy. Instead, the pharmacy is notified that you're enrolled into this program, and then they notify your drug plan, who then gives you the bill. So you do enroll through your specific drug plan. So remember, drug plans can be provided through standalone prescription drug plans or through Medicare Advantage plans, which offer you drug coverage. So it is the Medicare, what'd you call it, Susan? The Medicare M3, I forget the
M3P, the
M
Prescription Payment Plan.
M3 I can't say it. So I'm just going to say the Medicare prescription payment plan option. Oh goodness, it is Monday. But remember, this is for Part D coverage only. So it would not be if you have credible coverage through like the VA or maybe through your employer or retirement. It is only for those Part D plans through Medicare. So, like we mentioned earlier, filling those prescriptions you do not pay at the pharmacy, and then the billing is provided by your drug plan. So, they're responsible for the calculations of what those monthly installments are. Those monthly installments are going to be based on your out of pocket drug cost, and then it's divided by the remaining months left in the year. Now, I'm no mathematician, I'm a social worker at heart. So we are going to take a field trip later to Medicare.gov because they have laid out some really good examples on how those calculations are made throughout the year so that you can better feel comfortable if you are on this installment plan. Because even though it would be kind of nice if it was the same monthly payment from month to month, it can't be that way because it's based off of your incurred costs. So it's not projected on what you may feel later in the year or the following month, even if you're on the same medications from month to month, it's based off of what you feel at that time. All right, so another important thing to know is every year, Medicare Part D has different costs, figures, different deductibles, different regulations. And this year was a big news. So it was part of the Inflation Reduction Act. But there is now a $2,000 max out of pocket on all covered medications on all drug plans. So no person feeling covered's the key word there, medications on their plan can be billed more than $2,000 for the year. So that may seem like a lot of money, but there are a lot of expensive medications out there where we were seeing folks paying quite a bit more than that for their out-of-pocket costs. So this caps it at $2,000. So when we're talking about our payment plans, we know that you would never get billed more than if you started at the beginning of the year, you would never get billed more than what, $2,000 divided by 12 is, which I think is around 167. And we may have that written down here a little bit later. But just remember that. So just remember there is a cap and, your costs can be divided throughout the year. Okay, so could you benefit from this plan? Well, this payment plan option may help you manage your monthly drug costs, but it's important to also know that it is not a discount program, so it does not lower your overall drug cost amount. It just helps you spread them out through over the year. You are most likely to benefit from this plan if you're someone that does have high drug costs and is on more expensive medications. It can help you get it can help prevent you from getting hit with higher drug costs, including deductibles or high coinsurances that you may experience at the beginning of the year. So it is best to enroll in this plan, which we are still in the beginning of the year. It is best to enroll in this payment option towards the beginning of the year to get the best value so that you have more months to spread those costs out throughout the year. Enrollment can be done at any time during the year, though, so do remember that if you maybe get it onto a new medication that you weren't experiencing high drug costs before that new prescription, it is something that you can do throughout the year. So it's not a one-time decision during open enrollment or a one-time try. You can actually enroll in that during any time during the year. And then on the other side of that, you can disenroll as well. So if you no longer are experiencing high drug costs and you're okay with just paying the full amount at the pharmacy, then you may still have to pay what's left over in your payment plan, but you wouldn't have to continue that payment plan if you didn't want to. And some of those specific questions would be best for your drug plan as well. Okay, so this payment plan option may not be best for you if you're someone that's on generics or low cost medications, or your medications are kind of the same price from month to month, and you already have that built into your budget and it's working for you. Or if you're someone that may, yes, Susan.
What about the cost of the that you pay if you're using GoodRx or Needy Meds or one of those similar programs? Does that go into this prescription payment option?
Oh, we were just getting to that. That's a great question. So sometimes individuals may use alternative methods to cover their medications. So we've all seen the GoodRx cards at the pharmacy or at our doctors, or maybe even seen a commercial on them, but the white and yellow cards. And they are kind of a coupon, like a discount program. So you can use them at various different pharmacies. But I always tell folks that that's a cash price. So you're paying like the full amount of medication, or you're paying a full cost for your medications using that coupon, and you're not running that with your drug coverage. So when you use things like GoodRx, or there's websites called needymeds.org is another good resource for coupons and assistance programs. And then Single Care is another one that we keep hearing more about. All of those are discounts for paying medications out of your pocket fully. So you're not using your drug coverage when you use those programs. So this payment plan option, if you're doing that and that's a bigger cost savings for you to do that, then this payment plan option may not be best for you as well. If you're using the coupon for your medication, you're not using it under your drug coverage, so then you wouldn't be able to use the payment plan option for that medication, if that makes sense. And then other things that may, make you decide that it may not be the best option for you is if you're already getting lower copays through Social Security Extra Help. Sometimes you can benefit from Social Security Extra Help with limited income and resources, and you can get extra help on its own, or sometimes you may qualify for it by being a recipient of a Medicare savings program, or if you're on Medicaid or Pathways, any of those programs that would give you that extra help coverage. Yes, Susan.
Rick just texted in and he wants to know how you get information about extra help and the Medicare savings program.
Oh, that's a great question. And we're always so happy to spread information on that. So Indiana Ship, we help folks learn more about those programs. We help folks learn more about how to apply. So we actually, on the last page, we have our contact page. So we'll have our helpline number where you can talk to our friendly folks in the call center. You'll also be able to be directed to a local SHIP counselor or an enrollment center who can help you apply for the Medicare savings programs or extra help. And if you want to go at it by yourself, by all means, Medicare, oh goodness, the Social Security website has a Medicare tab, and within that tab, you can learn more about extra help and even apply for it as well. And the Medicare Savings Program, that enrollment and eligibility is done through FSSA, so you can contact them directly. But our SHIP counselors, most of them, and all of our enrollment centers, which is under the SHIP umbrella, they are trained to be able to help you apply and even assist you through the application process for those. So stay tuned because on the last page or two we will have our contact information so you can enter that. And if Susan's nice enough, she might even put that in the comment section of our video here. So you have our website and our phone number to contact us. But we love sharing information on Medicare savings programs and extra help because we love helping people have access to great health coverage that they can afford. All right. So, how to enroll? So, if we're looking and you're thinking, I am on some expensive medicines and it does make things more expensive at the beginning of the year, you may be more apt to looking into this payment plan option. So, the enrollment is done through your current drug plan. You can enroll through their website online, or you can call and enroll with them directly. So we had some individuals join this prescription payment plan option or the MP3 um, before they joined their plan. So during open enrollment, they may have picked a new plan. And so then during that time, they also enrolled in this payment plan option. So those approvals for that enrollment happen within 10 days if you're not already on that plan. So if you're new to Medicare or maybe you're using a special enrollment period to join a new plan, before that plan starts, if you go ahead and enroll in the payment plan option, they have about 10 days to process that request, which is about the same time they have to process your request to newly enroll into that plan. If you're already on the plan and let's say you go to the pharmacy and they say, oh, your medication is going to cost you this much, and you're thinking, oh my goodness, I wonder if I can pay this monthly. Well, you can call your drug plan. You don't have to fill that script right then and there. You can call your drug plan, and they have to process that request within 24 hours. So then the next day, you can come back into the pharmacy and get that script, and then your plan will bill you a monthly. They'll bill you based on the cost of that medication, and it'll be a monthly installment based on the remaining months of the year. So once you're enrolled, you still use your pharmacy. So the plan still pays the pharmacy. The relationship there does not change. It's just the only thing that changes is the plan manages what your out of pocket costs are instead of the pharmacy. So you still pick up your medications, then you get billed later by your drug plan. Now, if you're not sure what that monthly calculation is going to be or what that installment is going to be, and you want to better prepare for that cost, you can always call your drug plan and let them know that you just picked up picked up a medication from your pharmacy, and to try to talk to them about what to expect. Okay, so Susan mentioned that we were going on a field trip today. So I told you earlier I'm not great at math. So I started to type out some of these examples from Medicare.gov to try to summarize how you may be billed if you are enrolled in this plan. And then I thought, you know what? We're already virtual. We can just switch our screen over to Medicare.gov's website and look at those examples. So I'm going to pause and just make sure we don't have any questions so far, and then we'll go to that website.
We just had that one question. So just letting folks know, I did put it in the chat that you can type your questions in the comment section, or you can connect with us if you have our contact numbers.
Absolutely. So the website that we are going to is Medicare.gov, and I do have the link here just in case you are wanting to maybe explore that on your own. But we'll go ahead and get that pulled up. Thanks for monitoring that chat for us, Susan. Okay. All right. So I'm just on Medicare.gov's website. So just kind of another disclaimer here. When you are looking up things with Medicare or related coverages, it is best to go to Medicare.gov. They are the official website provided through the federal government for Medicare. So they are impartial, and this is where you're getting the information. And this is where we get a lot of our information from Medicare.gov and CMS, and so that we are accurate and up to date. So this is another disclaimer, this is the information that we know to this date. So as things change and progress, we'll keep you updated as much as we can, but this is what we know as of today. Okay, so the first example that we're going to look at is this Medicare beneficiary started participating in the MP3 in January, and they have high drug costs early in the year. Their total out-of-pocket cost is around $500 each month. So in January, they joined the plan. So let's look at how the math works. So first, they calculate your first month's bill in the Medicare prescription payment plan differently than the rest of the bills for the remaining of the year. So what's figured out first is the maximum possible payment. So earlier we talked about that there is a $2,000 annual max out of pocket for medications for 2025. So what that means is your monthly installment cannot be more than what $2,000 would be for the year. So they divide that by 12. And so then that would give you $166.67, which is the maximum possible payment for the first month. So then they figure out what you'll pay for January. They compare your total out-of-pocket costs, which is $500, to the maximum possible payment. And we know that that's $166.67. Your plan will bill you the lesser two of the amounts. So you'll pay $166.67 for the month of January. You have a remaining balance of $333.33, which is $500 minus the $166.67. Again, this is why I'm showing you rather than summarizing this on a PowerPoint. And it's bigger this way, easier to see. So that's how January is calculated. Now, as we move to February, you'll see that February is calculated at a little less. So you have 11 months remaining in the year. So that's the division that it will be by 11. So your remaining balance is that $333.33, plus your new incurred costs, because remember, every month our medications are $500. So then we take that $333.33 plus 500, that equals $833.33, divided by the remaining months, which is 11, which makes your monthly installment $75.76. So earlier I mentioned it does remind me of budget billing with your utilities. But what's different about this is it's not based on your projected cost. So that monthly amount is not going to be the same each month, even if your medications are the same each month. So keep that in mind that it's constantly going to be recalculated. So then they'll do the March payment just like they did for February. So your incurred costs are now up to $1,257.57, and that's taking your remaining balance plus your new drug costs. Then taking that divided by 10, because that's the remaining months left. So then your payment changes to the $125.76. So it's the same thing as we keep moving along here. So even though your payment varies each month, you'll never pay more than the total amount you would have paid out of pocket by the end of the year. The out of pocket maximum for prescription drugs, remember, is $2,000. So that's kind of how that's going to work. So here we can kind of see the chart on a bigger standpoint. So you kind of cap out at $181.31 starting in April. And then that's kind of what it remains to be until the end of the year. So it is an alternative way rather than paying $500 each month. You know, if you paid $500 each month, if you were in this payment plan, remember that $2,000 max out of pocket, you would pay $500 for 4 months and then you'd be capped out. So with this, you're actually paying the same amount, but it's being spread out. So it's a fraction of the $500. And then depending on the month and how it's calculated, you're going to see that kind of fluctuate throughout the year. So I just wanted to show you this. Yes, Susan.
So, share just a little bit about what happens if somebody no longer continues taking that $500 medication.
Right. So since it is based on your incurred cost, if we go back to our example here, um, let's say, starting in, let's see, don't get dizzy on me here. Okay, so let's say starting in April, you no longer have that $500 medication. So your monthly installment will now just be based off of your remaining balance because there will be nothing to add here. But let's say that cost changes to 700 or it goes down to 100 or 200. So that amount right here is what's going to be divided by 9 and give you your monthly installment. So that's why it fluctuates because, it's not projected. It's based off of what you still owe and then what you've incurred each month. So it's hard to explain, but kind of looking at it this way I think helps make more sense. And there's more examples on here. And I definitely, if you are thinking about this, I encourage you to talk to your drug plan about it to see how it works, see when you're going to get billed. It may, if you can decide what day of the month, sometimes that makes a big difference on when you're going to get billed for that monthly installment. And there are other examples here as well that you can look at on your own. But we'll probably just stick with that first one because if you're like me, if we do too much math at once, it just all blurs together. But yes, please visit Medicare.gov. You can use one of the cool things about Medicare.gov is at the top of the page, no matter what page you're on, there's this little search button here. I think my face is hiding it on Facebook. But there is, you can see it, Susan's saying, nope. There is a little search icon here, and you click on that, and all you have to do is type in, Medicare prescription drug payment option. That's what I did personally, and it took me to a few different links, all provided by Medicare.gov, that gave me this information. So definitely something to use in the future if you're thinking about this, or maybe you're thinking of a family member that you know of or that you care for that has high drug costs and you want to give them this information, please feel free to revisit our video. And just another reminder, we do check our comment section. So we do get notified for new comments on our videos. And if you have a question and you're not watching this live, please don't hesitate to still ask us those questions. Okay, any other questions regarding the website and our little field trip today?
No, nothing coming in.
All right. Got our nice little monitor there, Susan. We appreciate that. So we'll go back to our PowerPoint here. And really, all we have left to talk about, because we didn't want to go too much into the weeds, it's mainly just kind of understanding how the payment plan works, how you can enroll, and then how that's calculated. So hopefully we've given you that information today. But if you do have additional questions or you are interested in learning more about SHIP services, please give us a call. Our helpline is listed there in our website. So you can contact our call center. They can direct you to a local SHIP counselor in your area where you can meet with them face to face. They can also offer some of your questions over the phone as well. And then we do lots of fun things on social media, like these Facebook Live presentations. And if you're watching us now, then you obviously have seen us on Facebook, but we're also on X, LinkedIn, and then these live videos do travel over to our YouTube channel as well. So we keep these videos saved for later viewing as resources and references as well. So, just a reminder, we were asked about the Medicare Savings Program and extra help. So you can call our helpline to get more information about that, to get application assistance or help, or even just located to an enrollment center near you who can help you with that enrollment. And then Medicare is a great resource. So we were just on Medicare.gov. If you're not someone that goes online very much and you just want to talk to somebody about Medicare or your enrollment or anything like that, you can give them a call. And then if you're curious about how to enroll in this, or you just want to talk to your drug plan more about how they would calculate your monthly payments, and how that would work in your situation, you can contact them directly. So you can pull out your card and call the customer service line on your card, or you can visit their website as well. All right. So, Susan, I think I'm finished. So I'll let you wrap us up.
Okay. Do we have a slide with our, here we go, with our upcoming Facebook Live events? And I do want to point out that if you visit our website, medicare.in.gov, we also have an events page because this super cold, snowy weather is not going to last forever. And spring is around the corner, and we do get busy offering presentations around the state, and we are at various resource fairs. So to find out where we'll be in your area of the state, visit our events tab on our medicare.in.gov website and see us in person as well as on all of our social media. Okay, so March is around the corner. We only have one more week till February. So we've got 3 things lined up for March for our Facebook Live events. On Monday, on the 10th, we're going to be talking about special enrollment periods. There are many special enrollment periods that cover lots of situations. It could be new to Medicare. It could be you're leaving your job for one reason or another, and can I pick up my Medicare, and what else can I do? Lots of special enrollment periods. Maybe you're moving. So tune in on Monday, March 10th, and we'll tell you all about the different special enrollment periods and which one might apply to you. Then 2 days later, on What to Know Wednesday, we are going on I will be going on a physical field trip down to our main office, downtown Indianapolis, where we're going to talk to some of our call center coworkers and look at all the terrific resources that we have in our office that we're very happy to get in your hands by way of the USPS. So tune in and find out what all our office can offer you. Then we'll wind up the month on the 24th talking about these Medicare savings programs. So, Rick, if you want to wait till the 24th, we'll be telling about the programs and the extra help program, how you can access those benefits, who might qualify, and so on. But I'm going to stick in another one. On March 20th, we are offering a webinar, an evening webinar at 6:30. And this is the registration is through Eventbrite. So it won't be on our Facebook page. But if you just Google Eventbrite Indiana SHIP, it will be there, and you are able to register for it right now. So it'll be talking about all of Medicare, certain things that are important to folks who are thinking about getting their Medicare benefits, or if you're brand new to Medicare and you don't know what that insurance is or how it works. So tune in at 6:30 Eastern Time on March 20th. And Melanie, anything that I forgot or you want to add?
No, you did a great job. So, yeah, we're excited to get back out and face-to-face outreach events and health fairs. It's so fun to see people in person and do these too. But I will add, we do have an event on our Facebook page created for that new to Medicare webinar. So if you do go to that event page, you can actually click on the link, which will take you directly to the Eventbrite registration. So we are advertising it. We're just not doing it the same way we do these. So, absolutely.
And
But yes,
Eventbrite is super easy to use, so you don't have to worry about that. And there's no charge, of course. So spread the word, help us spread the word, and March 20th in the evening.
yes.
Well, Melanie, thank you for all your great information about the Medicare prescription payment plan and your other resource information. And we'll wrap it up for today. And everyone have a terrific Monday.
Bye, guys. Have a great week.